At least 20 patients are suing the maker of a dental device. They claim the appliance damaged their mouths. CBS News partnered with KHN for this exclusive investigation. Here's Anna Werner.
Clarinetist Boya Kragulya performed with symphonies around the world. This was her in 2013.
I've spent my entire life studying the instrument and trying to climb up the ladder of being a musician and always getting better at doing it.
But a breathing difficulty interfered with her playing.
My jaws are both too far back, and therefore it impinges on the airway and makes the airway really quite small.
Surgeons told her she needed double jaw surgery to move both her upper and lower jaw forward. But then she heard about a device on Facebook called an anterior growth guidance appliance, or AGA, a retainer-like appliance promoted as something that could expand the upper jaw without surgery.
It's predictable, it's stable, and it's safe.
This is the AGA's inventor, Tennessee dentist Dr. Steve Golella, seen here in Australia training dentists to use his device in 2017. He claimed that AGA could cure problems like TMJ and sleep apnea.
Can you cure TMJ? Yes. Can you cure mild to moderate sleep apnea? Yes.
Even make patients look better.
Good-looking people get all the breaks, they get the best jobs, they get the most money.
And he said it would benefit the dentist, too.
It's okay to make a crap load of money. You're not ripping anybody off. You're curing them. You're helping them. You're making their life totally beautiful forever and ever.
Kragulya says she went to a dentist who told her she'd attended one of those training courses.
How did she explain to you what the appliance was going to do?
She said that the appliance would grow the jaws forward.
She says she paid some $15,000 for the AGA treatment using a device like this one that attaches to front and back teeth. Soon, she says, she noticed a gap between her canines, those upper pointy teeth, and the teeth behind them, something she says her dentist told her meant her jawbone was growing forward.
I thought it was sort of miraculous and exciting.
But as the months went by, she says, her front teeth flared outward. Her dentist later put on braces she said were part of the treatment, but Kragulya says her teeth were loose and painful. So finally, she went to an orthodontist for a second opinion.
He lifted my lip up and just immediately said it was the worst thing he'd ever seen. And he was like, you weren't growing the jaw, and you have a really serious problem. You know, the teeth are completely out of bone, and the bone is gone.
And I mean, what's your reaction at that point?
I was in shock.
She says she can no longer perform on clarinet. In November of 2021, doctors had to remove her 4 front teeth.
It's just like sitting down and watching someone cut your fingers off. They're really gone, you know, and to see yourself without teeth is a bizarre experience.
Hers isn't the only story. A joint CBS News KHN investigation has found at least 20 people, including Kragulya, who have sued Dr. Golella and others over their AGA treatment. All of them said he consulted on their treatment plans with their dentists. We interviewed 11 patients, all of whom told us they wound up worse off than they started.
My front 6 teeth also became extremely flared outwards. All 6 of them, yes, they were doing this.
I noticed my teeth were starting to get loose.
I can't bite into absolutely anything.
I feel like all I have to look forward to now is treatment and pain and fear and debt.
Dr. George Mandelaris is a board-certified periodontist who saw Boya Kragulya.
Her mouth is a catastrophe. It's like a bomb went off in her mouth.
He says he's consulted with nearly a dozen former AGA patients.
How would you describe what they were subjected to?
Abuse.
And he says they needed urgent treatment.
Because if you don't,
they're going to lose their teeth.
Plain and simple.
Plain and simple. They're going to lose their teeth.
Dr. Mandelaris says he was so disturbed by what he saw, he went looking for any studies that supported the use of the AGA device.
There was none. None in the peer-reviewed literature. Zero.
In an email, Dr. Galella's attorney told us his client wouldn't sit for an interview, citing the pending lawsuits, but told us the device, now called the osteorestoration appliance, when properly used is safe and can achieve beneficial results for the patient, that it has been used by well over 10,000 patients, and Dr. Galella had had no complaints prior to the lawsuits. Yet in one of those lawsuits, Dr. Galella admitted he was not aware of any peer-reviewed studies or clinical trials demonstrating the AGA was successful when used on adults whose jaws have finished growing.
Dr. Galella?
Something we wanted to ask Dr. Galella about.
My name's Anna Werner with CBS News. I wanted to talk with you about your AGA device treatment.
Okay, talk to you.
How can you feel comfortable using the device on patients when you have no proof, no studies that it works? Dr. Galella?
Last year, a judge ordered Dr. Galella to provide before and after scans from 5 patients to prove his device works. So CBS News and KHN took those scans and asked 8 experts from dental specialties and schools nationwide, including Harvard and Columbia, to review them. Most said that expanding an adult's jawbone without surgery is physiologically impossible, and all said they saw no evidence that the AGA works.
The entire concept of this device, of this treatment, makes 0 sense.
They didn't grow bone in these patients. What they ended up doing was losing bone.
Is certainly not going to do what it claims it's going to do.
I've not seen one patient that has had anything good come from this device. Nothing. This is snake oil. This is crazy.
Grievous now has false teeth and estimates the cost to fix her jaw and mouth at $150,000. Plus, she may lose more teeth. That's what doctors have told her. Galella's attorneys in court argue patients were warned about potential complications, including teeth dying or removal of teeth. They also told us that Grievous' dentist installed her AGA incorrectly and kept it on too long. The dentist's attorneys declined to comment. But the device is still being marketed around the country, John.
It's an incredibly fraught piece to watch. Anna, tell me about why patients get this device in the first place.
You know, a lot of these patients are told by surgeons, perhaps, that they need jaw surgery. And that's a pretty scary prospect to people. They're going to cut your jaws and do all kinds of things. Instead, here comes this inventor and dentist who took his courses, and they say, listen, we can fix the jaw without jaw surgery. We can expand your jaw. That sounds good to these patients. So they go into it, and dentists who have taken the courses, their patients have reported to us and said in lawsuits that the dentists have told them that this is good for them, this is a good treatment for them, that it will work. And instead, what these patients have said is, no, it didn't help me, it harmed me. I've had loose teeth, painful teeth, thousands of dollars I'm facing in bills now to fix all this.
And also, of course, the psychological damage of this.
A lot of that, John.
Yeah.
Such a good point.
Oh, because anyway, we don't. But let me ask you this: the FDA regulates dental appliances, right? Where are they in this game?
Yeah, they regulate dental devices, right? So you want to know what they're doing. What we've learned is that it appears to us that they may not even have known this existed before we asked them about it. And we're going to talk about that tomorrow on CBS Mornings in our part 2 of this report. But basically, manufacturers are required to register their devices with the FDA. But for a variety of reasons stated by the inventor and his manufacturer, they say that they think that they didn't have to for a variety of reasons. We interviewed an expert who says that she doesn't agree with that. More from her tomorrow.
Well, all right. CBS Mornings will watch part 2.
Thanks,
Great
John.
work. Thank you. In part 2 of this CBS News and KHN investigation, we'll show you how the device got out into the market with no clinical trials, and no one at the FDA was apparently even aware of it. As Anna was just saying, you can catch that on CBS Mornings. That's Thursday at 7.